A good topic today, Medicaid eligibility. We're going to go over the Pickle amendment. I gave you guys a handout on that. We'll go over that when we get there. So I also gave you a eligibility reference guide, just so you have that as well. It gives you the monthly incomes and things like that. It's a really good resource. And then on the second page of it, it's a list of all of the TennCare programs. That is the most that anyone could make and get Medicaid assistance from TennCare. It's very low, and it's really difficult to get on the programs. And depending on the different categories, that eligibility is different. We did not expand the Medicaid program in Tennessee, so it is a little bit harder for people to get on it as far as financially. And the categories, they don't expand, they don't cover a whole lot of people, but we'll go over those in a second. So to be categorically eligible for TennCare, they either have to be pregnant, a child under the age of 21, people who have a disability that gets a Social Security income. Those are the ones that we deal with the most as far as SHIP representatives, or also the elderly or people living in long-term support services. They may be on the Choices program, and we will deal with them because they're full benefit dual eligible at that point. So we'll kind of go over the nuances with that as well as we go. To be financially eligible for TennCare, it is based on that federal poverty level, and that chart that I gave to you all is the handout. That gives you all the way up to 250% of federal poverty level. That is the most that anyone could make and get Medicaid assistance from TennCare. It's very low, and it's really difficult to get on the programs. And depending on the different categories, that eligibility is different. It might be 100%, it might be 200%. It just depends on what program you're on. So as far as the handout, you guys have it. If you do have any questions about it, if you want to get in touch with me, I'm more than happy to go over it with you. I'm more than happy to go over it with you. Have given Medicaid eligibility. If a person meets both from categorical and financial eligibility, or they are medically needy. Those medically needy categories are very few and far between. People who are either pregnant or who are under 19 or under 21 who have to go over it since I have given it to you. Medicaid eligibility. If a person meets both from categorical and financial eligibility, or they are medically needy. Those medically needy categories are very few and far between, and it's for people who are either pregnant or who are under 19 or under 21 who have extensive medical bills that they need to get paid, that they may qualify, it may qualify them for Medicaid as well, but they do get full Medicaid benefits. They do have a managed care organization, and in Tennessee we have Blue Care, we have AmeriGroup, and we have United Healthcare as those MCO choices. So they have extensive medical bills that they need to get paid, that they may qualify, it may qualify them for Medicaid as well, but they do get full Medicaid benefits. We Blue Care, we have AmeriGroup, and we have United Healthcare as those MCO choices. So they can pick which one they want to be in. I always try to tell people, if you are going to a specific facility, you may want to check with them to see if there's one that they prefer over the other. It's always good to know if you're going to be covered. Not all doctors take Medicaid. It is really, sometimes can pick which one they want to be in. I always try to tell people, if you are going to a specific facility, you may want to check with them to see if there's one that they prefer over the other. It's always good to know if you're going to be covered. Not all doctors take Medicaid. It is really sometimes hard to find a doctor with Medicaid. So you always want to check with them to see if they take that MCO. It's hard to find a doctor with Medicaid. So you always want to check with them to see if they take that MCO, whichever one you pick. And if they get the health care coverage through TennCare, you go to the doctor, you can get your treatments, you can get anything, and TennCare pays for that care. It is through no one else. They can't have any other insurance on top of the TennCare Medicaid unless like a parent's working and whichever one you pick. And if they get the health care coverage through TennCare, you go to the doctor, you can get your treatments, you can get anything, and TennCare pays for that care. It is through no one else. They can't have any other insurance on top of the TennCare Medicaid unless like a parent's working and they have employer coverage and the child is there, if they're still low income. They still have to have employer coverage and the child is there, if they're still low income. They still have to meet that categorical and financial eligibility to get it. So the Pickle Amendment, so we were talking about the SSI a couple of slides back. SSI is a program for people who are very low income, who are over the age of 65, or that categorical and financial eligibility to get it. So the Pickle Amendment, so we were talking about the SSI a couple of slides back. SSI is a program for people who are very low income, who are over the age of 65, or if they're disabled, to get assistance, financial assistance from Social Security. Or if they're disabled, to get assistance, financial assistance from Social Security. They have income less than $773 to get the SSI program. If their income is less than $773, they automatically qualify for Medicaid, and they automatically get it. Now, with the Pickle Amendment, they have income less than $773 to get the SSI program. If their income is less than $773, they automatically qualify for Medicaid, and they automatically get it. Now, with the Pickle Amendment, there is a kind of a workaround for someone who there is a kind of a workaround for someone who had SSI at one time, and then they started getting Social Security benefits that booted them out of the SSI program that was more income, who had SSI at one time, and then they started getting Social Security benefits that booted them out of the SSI program that was more income. But if they got in between, I think I just saw somebody said updated me. I gave you last year's numbers as far as the SSI. I did say that. So the oh, I lost my train of thought. The Pickle Amendment gives them a chance. to still keep Medicaid, even though they're over the income guideline, but they use, on the handout that I gave to you, I gave you, there's a chart on the second page, and you can actually decrease their income, their monthly income, by a certain amount, and they will be able to qualify for Medicaid categorically. It is not, so when you get a caller like that, where maybe their income is way over guidelines and you're like, how do they have Medicaid? Ask them if they ever received an SSI check and a Social Security check at the same time, and that may be your answer, because they may be deemed an SSI recipient due to the Pickle Amendment. The Pickle Amendment is very confusing. That's why I gave you this really awesome handout. It explained it in more detail, in my opinion, than anything I've ever seen on the Medicare sites and things like that. It explains it so much better. It gives you some examples to read through, so you can kind of get an idea of what the Pickle Amendment is. I know it's hard to explain, but basically if they qualify with the Pickle, they qualify as an SSI recipient because they received SSI at some time in the past. So.
Lori, we are no longer seeing your screen.
Oh, I'm so sorry. I don't know why. It looks like Linda took my ball. Yes. Okay. Linda Johnson came in and took my ball from me. Okay, let me go back again. Share content. Screen 2. Okay, you see it now?
Yeah. Yes.
Okay. All right, and we're still recording, so that's good. Okay, so if you guys have any questions, after you read over the Pickle Amendment handout that I gave to you, if you do have any questions about it, feel free to give me a call and we'll try to work through them. Like I said, it is confusing and it's really disorienting when you hear someone say, I have $2,300 a month income and they're on full Medicaid. So, but you can actually figure out it's probably the Pickle Amendment if that's the situation. Okay, now, all right, so choices. Choices eligibility gives a person full Medicaid. It is to help pay for long-term care in either a nursing home setting, or if they want nursing care at home, it helps to pay for that as well. It also gives them full Medicaid. So they are Title 19 Medicaid at that point. And it is a community, it helps with the home and community-based services. Basically, it helps them do everyday activities if they need skilled care with dressing, getting around. They actually even help them, prepare meals and do chores around the house. So it does help with that. And they do get the MCO, just like a regular Medicaid recipient, and it gives them all of the benefits of Medicaid as well. So they do, for choices eligibility, they do have to qualify categorically and financially. They do have to have a PAE, and forgive me, I do not remember what a PAE is. Basically, they have to meet certain criteria as far as what their ability to, yes, pre-admission evaluation. Thank you, Nancy. So they need that to make sure that they do qualify under those categories, as far as, you know, if they can dress themselves, if they can toilet, if they can take care of themselves. If they cannot, then they get a score on the PAE, and it goes through to the screeners, and they actually look at that and see if they qualify for the Choices program. They still have to qualify financially as well, but the income guidelines are a little bit larger than the $783 limit. So it does give them a little bit more ability to get the program, even if their income is a little bit higher. So categorically eligible, there it is. I should have just gone to the next page. It is, like I said, they need that pre-admission evaluation first. They have to get that through their local AAADs, and they will screen them for the Choices program. So the financial eligibility for Choices is currently 300% of SSI. It's $2,239. But their resources are very low, as in, like QMB, you can have over $7,000 as far as your resources. With the Choices, it's less than $2,000, and there's some other nuances with that I'm not going to go into. There are some other Choices levels that they can go into. They have different Choices 1, Choices 2. I'm not going to go into all of that. Just know that there is a Choices eligibility. So if their income, again, if their income is over that limit, ask them if they are receiving home-based services, if they are not getting SSI or have not been getting the Pickle Amendment. You could ask them about Choices. So dual eligibility means that people are enrolled in both Medicaid and Medicare. They have A and or B. It doesn't matter which one. It's just some form of Medicare, and they have some form of Medicaid. So they are dual eligible. So Medicare, I'm not going to go into this because everybody should know how we get Medicare. This was just already in here. I didn't want to take it out, but you know, of course, Medicare is not means tested. They do not have to have a specific financial ability for Medicare, except if there is a low income, you know, they get those assistance programs. So there's two types of dual eligible people. You have the partial dual eligible people, and those are the people that are on Medicare savings programs, QMB, SLMB, QI1, the QDWI, and then the full benefit dual eligible, which means that they are on one of those categorical or financial Medicaid programs. So they are either or. So partial dual, they have a certain income level, and of course we know our QMB, SLMB limits. If you do not, it's on the very bottom of that TennCare handout that I gave to you. It gives you the resource limits, the income guidelines, and things like that. So you do have that, and they do have their Part A and or Part B premiums, deductibles, and coinsurance is paid for by TennCare. They do not receive full Medicaid benefits. However, these Medicare savings programs are not the same thing as Medicaid. They're funded differently, and it's not the same program. Now, with the QMB program, there's 4 types we know of: the QMB, SLMB, the special low-income Medicare beneficiaries for qualifying individuals, the QIs, or those QDWIs. Those are the 4 types. And then, so with these, they are not getting full Medicaid. Did I go backwards? I did go. No. Okay. So the QMBs, they have an income below 100% of federal poverty level, which, going to our chart, is the $1,064. This does not include the $20 disregard that Medicaid in Tennessee looks at. They keep a $20 disregard across the board. So these numbers do not include that, so you have to add that in. So for QMB, it acts as a supplement. It's very similar to Medicaid, but it is not Medicaid. It pays for doctor visits. It gives them a little bit of protection as far as balance billing and things like that, but it is not Medicaid. So when people call and say they have TennCare, you need to make sure that they're not QMB eligible, and they're actually Medicaid eligible. So the SLMBs and the QI1s, they get their Part B premium paid, but they do not receive any doctor services. So they're not going to pay for either doctor visits, no deductibles, copays, or anything like that. They are only going to pay that Part B premium. It is definitely not full Medicaid, so they do not get that assistance at all. The QDWIs, these are people who are disabled, they're working, they're under the age of 65. They have a bit higher income because they are working, but they can keep their Medicaid, and they also get the Medicare Part A paid for. They may not get Part B paid for because of their income, but they do not get full Medicaid. I'm sorry, I don't know why I said they get full Medicaid, but they are entitled to Medicare. They get their Medicare, they get their A paid for, and their B may not be paid for. So we do not see these people very often. I think I've dealt with one person in the 5 years that I've been doing this, so it's not a very common occurrence. So the second type of dual eligibility is full benefit dual eligible. These are the ones who are Medicare and Medicaid. Both of them they're eligible for both. They get Part A and or Part B. They are under the income guidelines for Medicaid. They fit into one of the categories of Medicaid, and they receive both. For these people, they have lower income guidelines, and they also have lower copays for medication, even than people who are on QMB, SLMB. So they are very low income. So we do a buy-in. A buy-in means that TennCare is paying for a person's Part B premium or their Part A premium. They make the payment for them. TennCare, either through the QMB program, SLMB program, full Medicaid, for whatever reason, they are paying their premiums. So TennCare is supposed to report the buy-in for these situations, whether if they have QMB, SLMB, or QI1, and they need to be enrolled in Part B. If they're an SSI recipient who has just aged to 65 and they need to have their Part A established, they are supposed to notify them then. SSA, Social Security establishes Part B. What I have found, it is best if you just go ahead and refer them to, if they need their Part A, go ahead and refer them to Social Security to get that signed up too. What I always tell people is to call Social Security and request request Part A to start contingent upon getting Q&B, which if they are an SSI recipient, they automatically qualify for Q&B. So if they do get Social Security, they will have that Part A and Part B covered through the Q&B program. So they also report if a person's approved for Q&B and enrolled in Medicare B but must have Part A established, like I said, call Social Security for that, because they'll kind of get it started on their end, whereas TennCare tends to be kind of slow on things, but they will get it done. It takes some time sometimes. So what do we do if there is an issue with a buy-in process? Maybe you've gotten a caller who is still getting premiums deducted from their check, or if they go in and they see their check is lowered somehow. It may be a buy-in issue. What we do, we have a contact at TennCare that we send the information over to. They only like the information to come from one person, and that's usually from us up here at TCAD. I am that person that sends those over. What I request that you guys do, just send the information to your regional coordinator. I need that information that's on the screen, a name of the client, their Social Security number, a date of birth, or in any other information you feel about the situation that may be important, whether it is their Medicare start dates. If you feel they tell you, oh, I did an application and I need assistance with it, you can get them to tell you if they know the date that they applied, if they have proof that they mailed it or faxed it. Anything like that you feel like would happen, that would help. I would be very appreciative of that information, because I pass that on to them and they can look at all of the situations and they can give me a little bit more feedback as much information as I could give them. So if you will send that information over, then they send it to me and I will get it to TennCare. I usually send those out weekly. Lately, we haven't been having as many. I haven't noticed as many of them coming in. So I've been sending them pretty regularly, maybe even 2 or 3 times a week. It's not been too much to send to them. But if you do have any situations, that's what we would like you to do. So I know that is not very much information. Like I said, a lot of these topics, we deal with the Q&B, SLMB questions a lot, and we deal with the full benefit dual eligibles. Pickle amendment, like I said, maybe once or twice since I have been here. The QDWI individuals once, I remember. And it's just not very common that we deal with them, but they do happen. If you ever have any situations that come up that you are unsure about, send the information over to your regional coordinator, and if they can't help you, then I am more than happy to help. They will get in touch with me, or you guys could get in touch with me, and I am happy to help with the situation, and we can work it together. So does anybody have any questions? I'm going to go to the chat. I haven't had it open, so let me see if there's been any questions. And thank everybody for signing in. If you have not already signed in the chat box, go ahead and do that. I appreciate everybody putting their name in. Okay. And thank you, Kimberly, for putting in the information about the Pickle contact. That's really helpful. Okay. Okay, Kimberly, I am actually in Nashville. I work in the TCAD office. I actually started up here in June. Prior to that, I was at GNRC for 5 years with the SHIP program. So I've been around a little while. I've just been in this position very short time. So I'm still learning everything, and but I am in the Nashville TCAD office. Does anybody else have any questions? I figured you guys would have a lot of questions, so I tried to make the PowerPoint shorter so that we could go through questions. So we might actually finish up early. Has anybody had any issues with any? Okay, yes, I'm happy to repeat that. The Tennessee MCO providers are AmeriGroup, Blue Care, and United Healthcare. Those are the 3 providers here in Tennessee. And if someone has, transportation issues and things like that, you refer them to those MCOs, and that helps out a lot, that they have one specific person to go to or a group. All right, well, I guess if there is no questions, feel free, if you don't want to chat it, if you want to unmute yourself and speak, I'm happy to hear a human voice besides mine. So, yes, to apply for, okay, so a person applies to MSP. So no, for MSPs, we can actually help people with those applications. I would not refer Social Security to refer them to Social Security for MSPs because if you if you refer them to Social Security for MSP, they're going to refer them back to us to do the application since we help with that. Now, if they are SSI eligible and they would qualify for Medicaid through SSI, whether it's to get Part A or to get Part B, I would refer them to Social Security for that because Social Security can start their Medicaid if they move here from another state and they had Medicaid in that state and they would qualify here. I would refer them to Social Security to update their address and make sure that they are they're updated, and then they will update their TennCare to change it from whatever state they were in to here. But that's really the only thing that Social Security will help with that. You could also do a TennCare Connect online application with them. That is a really good way to do the application. Also, just doing the paper application ourselves and mailing it to them, that tends to take a lot longer, but you know, it does get the job done, and it is an option. Okay, I have a person who has SLMB, but only 75% LIS. Oh, that's interesting. That may be something we talk about, Sheila. So find out what's going on with that. It may be that she has some resources or something like that, that maybe she's on some really expensive medicine, that they are just kind of, I don't know, that's really odd. So we might need to check into that a little bit further. Just get in touch with me. You could email me the information if you'd like. So, all right, so if nobody has anything on the recording, I'm going to go ahead and stop the recording. And then if you want to talk about anything else, we could do that. Let me stop the recording.